Good evening, everybody. This is Darius Assemi, your host at GVWire's Unfiltered podcast. Welcome, by the way, along with my co-host, Dr. Bill McEwen. I'm sorry, not Dr. Bill McEwen, Doctor of Journalism. Uh, the spiffy-looking Bill McEwen tonight. Welcome, Bill.
Thank you, Darius.
Mike Carbasi did not do a pre-recorded session. I don't see it on the lineup. So we're going to get right to it. We have Manuel Bonilla representing Fresno Teachers Association coming on in about 30 minutes. Talk about all things Fresno Unified, future Fresno Unified, issues with healthcare. Should retirees, and when will retirees at Fresno Unified get healthcare benefits? He'll kind of break that down on the latest negotiations with the Aetna and Clovis health systems. I'm sorry, community health systems. A lot to unpack there. But before that, we're going to get into a round robin of items impacting us and across the world. We'll start with our weather forecast. There it is, beautiful cloudy days. Those of you that have visited other countries, especially Northern European countries, this weather reminds me of Northern Europe, kind of throughout. A little damp, a little moist, foggy or overcast almost every day, especially Northern Europe. But 50s, high 50s and 60s, lows in the 40s, but a nice sunny weekend with around 60-degree highs. So thank you, GVWire team, for putting that together. One of series of polls that we have, and this poll will stay on for a while. Do you support U.S. military intervention in Iran? Are we ready for more wars in that part of the world? That poll is up. It'll stay up for another week. Feel free to address, to fill that out. 64% said no. When he was elected, President Trump said he would keep our troops home and also end all the wars. So again, that poll will stay up for a while. What to know about Trump's Board of Peace for Gaza? We know that the Turkish President Erdogan is on. I don't know if Bill has any more insights on who else is going to be on that Board of Peace for Gaza, and I don't know what that means. We know that we've heard that Gazans are going to be pushed off or shipped off to whoever's alive, left alive, and not dying of starvation, is going to be shipped off to Somalia, part of Somalia, and some kind of a deal potentially being put together. But Canada, France, Britain, Saudi Arabia, maybe it looks like are on the list. Bill, any more insights on this?
Well, the French President Macron said today wasn't interested in being on the Board of Peace, didn't like the scope of the operation. President Trump had a news briefing today, covered a lot of ground. It was on the anniversary of his first year in office of his second term. And he said he could see the Board of Peace replacing the United Nations. He said the United Nations is ineffective at ending wars, and the Board of Peace could get that job done. Also, he's extended an invitation to Putin to be on the Board of Peace.
Okay. Did he say if it's okay for Putin to take all of Ukraine? Did he say anything like that?
Oh, no, he didn't say anything like that. However, on Greenland, he said, well, I've come up with something that will make NATO really happy. And, President Trump's going to the big meeting in Davos. He'll be speaking there tomorrow. A lot of people very interested, including our allies, in learning what he has to say, because these threats about taking over Greenland, I think most Americans don't believe he's serious, about invading the country or owning the country. But our NATO allies are very worried about it. In fact, in Canada, the leader of that nation over the weekend said, well, if NATO allies are attacked, Canada is a part of NATO, we will defend. So he laid open the possibility that if things got out of hand, the United States would be at war with Canada. Of course, we hope that doesn't happen. President Trump says many, many things. Um, some people even say we shouldn't pay attention to them anymore, but you have to pay attention because the 5 or 6% that he actually acts on can be devastating to the country. In addition, all his rattling on about Greenland has, sent tremors across the stock market. There was a big sell-off today. People are placing, have more faith in the euro or increased faith in the euro, less in the dollar. And I saw one really sharp analyst say that, yes, people are hedging their bets when it comes to the United States of America because it's no longer viewed as reliable when it comes to international finance, foreign affairs, and other important matters.
Thank you, Bill, for that explanation. There is Greenland. We have a great map. Thank you to Paul Marshall for producing that. That shows, or at least putting it up on the screen, where Greenland, the size of Greenland, which is just incredible. And from what I understand, also Greenland has a lot of value in the Arctic commerce. Russia has got a bunch of icebreakers in that area that can, help short circuit the travel from Europe to North America and maybe other and potentially Asia, and also lots of shortest route to the United States from North America is over Greenland because of the arch of the Earth or the shape of the sphere. So has a lot of strategic values. But the question is, we already have multiple bases there. Does Greenland? Here's the question. I wish President Trump was here. Does Greenland have a lot of minerals that make it even more valuable that we know, and maybe the Danes don't know? Bill?
So Greenland has a lot of value in regard to natural resources. Much of it is yet to be exploited. But the big thing here is its placement in the world, its geography. It's very important to military defense for the Soviet Union, for the United States. We've been there a long time. My late father was stationed in that part of the world for a considerable amount of time, and I remember the things he would say. And when he was alive, he told me that we had nuclear capabilities at our base there in Greenland. We're now told that all those nuclear capabilities have been removed. We're talking about the military and the US government, so we don't know for sure. As an example of that, my father was also stationed in Iceland. And when the United States announced that it was removing all of its military from Iceland, my dad said at the time, that'll never happen. It's too important. And they made that announcement about 10 years ago. And if you'll remember, Darius, 3 or 4 years ago, the US admitted that it still had a military presence in Iceland. It's very important to us. The thing I don't understand about the Trump administration, well, I do understand he wants the minerals, he wants the economic potential of the area. That's why he wants the US to own it. But if we're talking about the military strategy behind the acquisition, doesn't really make sense because we're already there now. We already have bases and we already can do what we need to do.
Okay.
And so, Darius, I have to
Yeah.
ask back at you. I mean, did you think you would see the time when the United States would just say, we're going to buy that country, we're going to take over that country, and not really
No,
give the people involved a say in it?
if the people had a say in it and said, "Hey, we want to become part of America." Matter of fact, I'm gonna go on a limb now. If you surveyed people of Iran, my guess is overwhelming majority would say yes. Can we please become the 51st state of the United States in the Persian Gulf? But here's people have to, yeah, if we don't involve the people, get their buy-in, we're just, it kind of reminds me of Godfather, the first one, and how the most more powerful person in the neighborhood ends up basically controlling the neighborhood temporarily, not forever, until the next Godfather comes in and goes, "Hey, we can do the same thing. Let's just get more missiles and more technology and more cyber technology or whatever it is."
So
But
the other
yeah,
thing, Darius, is, do we
yeah,
really want to spread ourselves that thin? I
no,
mean,
we
the
don't. No, no. You know what? That's why Trump is asking for a $500 billion increase in defense spending next year. 50% increase, $500 billion. And where's that money going to come from? Are we going to get more cuts to other programs here in our country? To be seen. But I've got a question. For those of you, I'm going to age myself. I'm proud to do that. Those of you that remember this, which country was Ice Station Zebra not filmed, about? Bill, you should remember it. I was a few years old, I don't know, 8 years old when I saw that movie in Tehran. It probably was a rerun. We didn't get it when it came out in the theaters in the United States. Clint Eastwood, if I remember correctly. Ice Station Zebra, very fascinating movie. It was somewhere in the Arctic or Greenland or somewhere up there. Anyhow, okay, let's move on. We got lots of stuff to cover before Manuel Bonilla comes on. Let's see. I think we can skip. Israel invited to join Trump's Board of Peace. Okay, we talked about that. How war with China begins. New York Times article. Top priority for U.S. foreign policy must be deterring China from attacking Taiwan without provoking China. And really, the question is, if you're China, you go, gosh, United States just took Venezuela and all its resources. Can we just take this small, tiny island of Taiwan? And yeah, we'll see if that materializes anytime soon. President Trump links his push for Greenland to not winning the Nobel Peace Prize. By the way, Bailey, like you said, there's a lot of people waiting to see what President Trump's comments are about United Nations, NATO. We'll probably hear it as early as tomorrow. When Trump speaks, markets move down 2% today, which is I don't know how many trillions of dollars that it evaporated, but we'll see where this goes. And Paul Marshall put together our very own Nobel Peace Prize for President Trump. There it is. There'll probably be a poll on that starting tomorrow. Do you support President Trump getting that Nobel Peace Prize? Great job, Paul Marshall, creating that beautiful Nobel Peace Prize. But I guess the size is slightly smaller than that. President Trump sharing leaked text and AI mockups vows to going back on Greenland. I don't have a whole lot on that, unless if Bill does.
So, Darius, I mean, the concern here is that President Trump received a private message from NATO member Denmark, and then he turned around and put them on social media.
Okay.
How would you like to be dealing with that situation?
Wow. Okay. I guess this is we're going to put a couple of images of folks. Must be this Denmark, right? Protester takes part. I'm sorry, in Copenhagen, Denmark, about Greenland. This was on Saturday.
Yeah, so Darius, a lot of protests in both Denmark and Greenland, and of course, Greenland is a territory of Denmark, and there's going to be a vote in the future about whether Greenland would have independence. And I think perhaps that prospect of the residents there voting to go to independent, becoming an autonomous nation, that might be spurring President Trump in regard to his remarks, his saber rattling, and everything else.
Okay. Now we're going to move on to a few of the latest news on ICE. Broke into Minnesota home, forced barely clothed Hmong man outside into the snow. This was Reuters. Reuters has several articles on ICE and Minnesota. And there's a rally here last week, and there's another rally this week. Is that correct, Bill?
Actually, protests going on tonight downtown outside ICE headquarters opposing the actions in Minneapolis. So, yes, we've had two protests already in Fresno on this very subject. Again, with this situation with the man, the elderly man there in Minnesota, and you can see, he was taken outside. He's got a blanket around on him and some shorts. It's very cold. You can tell how cold it is by how the ICE agents are dressed. They get to be warm. And he had his papers. It could have been taken care of in the house. Instead, they took him downtown or to an ICE holding facility there to check out his papers. And of course, he had them. And, that begs the question, why are ICE agents stopping American citizens, decorated veterans, anybody, and doing these detentions when in fact they have their papers, they have their license, driver's license, they have their passport. The only reason they're doing it is for intimidation. This is deliberate provoking of the American public. President Trump likes a fight, and he's ordered his, I wouldn't call them law enforcement. ICE agents are not law enforcement. Law enforcement is professionally trained. It knows how to handle a situation, treats people with respect, except for a handful of rogue officers. Really, ICE agents, this is President Trump's personal paramilitary troops.
Is it, you think President Trump, or is it Stephen Miller, one of his key advisors that is?
Well, the buck stops with President Trump. And yeah, clearly this comes from the warped brain of Stephen Miller.
Thank you, Bill. By the way, let's put that poll up. There's an article that came out. ICE crackdown creates double H campaign issue for Republicans and Democrats. And there's a poll referred in this article. There it is. That basically, yeah, thank you, Paul. Basically talks about, how should immigration officers conduct their raids? And then the orange is use force despite risk of serious injury or death. Republicans at 59%, Democrats at about 4% or less, and others, what decline to state or whatever they may be, 19%. So if you add, the 19 plus the 4 of the Democrats, so 23% of non-Republicans. I'm sorry, 23% of America, Democrats and others, if this poll is accurate, say that use of force despite risk of serious injury or death is okay by ICE officers.
So
there was a six. Let me just say one more point. Those of you that haven't watched 60 Minutes had an episode on Sunday night. Great interview with the Minneapolis police chief and the head of ICE on the issues, pros, cons, challenges, ramifications, how this impacts other folks, other Americans, folks in our country that are born and raised here for generations. Bill?
So I wanted to point out that even among Republicans, 4 in 10, nearly 4 in 10 Republicans don't approve of these tactics. The other point I'd like to make, and for you to digest and react to, Darius, there are an estimated 133,000 undocumented immigrants in the state of Minnesota. And we have all these troops here, thousands of ICE agents. In Texas, there's 2.1 million undocumented immigrants. Have we seen this go down in Dallas? Have we seen this go down in Texas? No. In Florida, there are 1.5 million undocumented immigrants. Florida gets a jolt to its economy by hosting a new detention center. But have we seen widespread tactics like this going down in the
Well,
state of Florida? We haven't, and we have seen it in California. What do Minnesota and California share? They're blue states. What do Florida and Texas share? They're red states. You can't say there's no rhyme nor reason to what President Trump is doing. Clearly, he's punishing the undocumented that reside in blue states and ignoring what's going on in red states.
Well, Minnesota, as far as I'm thinking the president is concerned, has two things going against it. Tim Walz, governor, which has had some challenges, some accusations, and also House of Representatives Ilhan Omar, immigrant, I think from Somalia, is also represents parts of a district in Minnesota. But you make a great point, Bill. If the majority of undocumented folks are in those two states, Texas and Florida, why are we spending so much time in Minnesota? Yeah.
Well, I think we know the answer.
Yeah. And then U.S. I'm just reading this, Department of Justice delivers subpoenas to offices of Governor Tim Walz, Attorney General Keith Ellison, who used to be a member of the House, and Minneapolis St. Paul mayors Tuesday. Okay. That's any comment. Wesley Zimmer, ICE is paramilitary agreed. From Wesley. Okay. Before urban raids, Border Patrol tested tactics in California's Kern County. That was news to me. Article from New York Times.
And you can read it on GB Wire, as a lot of our readers are doing, Darius. Well done story.
Awesome. Thank you, Bill. Kerman mayor objects to ICE language in law enforcement proclamation. That's Mayor Maria Pacheco. Is she the one that's running against Mike Carbasi?
Yes, yes, against Mike Carbasi and others, and people are waiting to see if Kerman City Council member Gary Yep will also wade into that race. She's also an aide to Assembly member Esmeralda Soria.
She's related to Esmeralda, or
no, she's an aide. She's on the staff. She's an aide.
Got it. Okay. Aide to Assemblywoman Soria, who's running for Senate in the California legislature. So city staff said the language was a copy and paste error, later corrected without council action. Controversy unfolded as I'm going to make sure I'm saying it, Kerman Mayor Maria Pacheco campaigns for Fresno County Supervisor. Okay. Our guest is here, so we're going to go. We have just a couple more slides. Clovis Police confirms ICE operation after video sparks online panic. That was in North Clovis. Is that correct, Shepherd? And
Shepherd and Willow.
Willow. Do you know which business they were at, or was it somebody's home?
So I don't know that, Darius. What we believe was going on was It involved ICE, but it also involved DEA. And so this wasn't like a raid or a crackdown. It was actually going after a targeted individual.
Got it. At Willow and Shepherd Avenues in the very north Clovis.
And the reason why we ran the story and followed up on that is just because there were so many rumors going on social media about the situation there.
Got it.
So Tony Haddad was able to contact Clovis Police early this morning and came up with
Got,
what happened there.
got it. Thank you, Anthony, for your GV Wire manager for following up and getting that story out. Fresno activists and activists, including our mayor, that's Mayor Dyer, Sandra Celadon, Executive Director, Building Healthy Communities, and Veronica Garibay, Executive Director, Leadership Council for Justice and Accountability. They have their own version of Measure C. The plan that they've unveiled matches the one that could not get full support from the Council of Governments. The plan would dedicate 65% of the $7 billion in taxpayer funds to road repairs and 25% to public transit. Doesn't leave much for congestion relief, and that's going to be my problem. We need congestion relief, at least for me to support. We don't want to be Southern California. We don't want to be LA or San Jose in the next 5 to 10 years. Already 41 in the mornings, 7 to 8:30, and in the evenings 3:30 to 5:30. Difficult to navigate. Confusion shrouds Annalisa Pereira's, that's Councilwoman Annalisa Pereira's abstention in Fresno Council leadership vote. Mike Carbasi got a repeat as Council President. The vote was last Thursday with one abstention that was from Annalisa Pereira. Article by David Taud. Now we come to Fresno Unified. $30 million investment to support students is paying off. I don't know if Manuel Bonilla can shed any light on that, but we're going to get into health insurance options after a long fight that's been going on there. Manuel Bonilla, let's bring Manuel up. Manuel, welcome back to Unfiltered. We understand that you come. Is it true that you just come from a meeting with all the key folks, stakeholders, Aetna, Community Health Systems, Fresno Unified, and you have an update on will retirees get health care? Wasn't that just signed? Didn't you just sign off on that? You're on mute, so we can say whatever. Yeah, that's. I think sounds like man. We can't hear you. Say that again, Manuel. No, you're on. We cannot hear you. It's, I think, on your end, Manuel. Well, here, while you may have to unplug and replug or retest your audio. But just a thumbs up. Do we have a deal right now with healthcare and Aetna? No, we don't have a deal. Are we getting closer to getting a deal with Aetna and community health systems, but to take care of the retirees? Oh, there you go. I think whatever you did, we can hear.
Can you hear me?
Yeah, we can hear you now. Yeah.
So
oh, wait a minute. You went off again. We can't hear you. You may need a non-FTA microphone for you. We can send you a GV wire microphone. No, we still can't hear you. Okay. No, we still can't hear you. But let me just ask this question.
Testing 1 2. Can you hear me now?
Right.
Yes, we can
Okay.
hear you now.
I'm sorry. That's the first time I've ever had that issue. So I'm gonna sound a little echoey, I would imagine. So I apologize for that. I believe the question was there a meeting? Not that I know of in regards to it. So you're telling me something new. If that's the case, you would probably know more in that situation than I would at the moment, because I do not know of any updates at this time. Now I can't hear you, Darius.
Somehow well, no, that was on my, somehow somebody,
Right. Can you hear me? I just want to make sure.
No, can you hear me?
I can hear you now.
Okay, good. I think that was on my end.
Okay.
Okay, so when can, we got all the GBY articles. It's going to take a year. January of 2027 is when some of this stuff is going to go into effect. So if you're a retiree that needs health care, whether you're 20, 30-year retiree of Fresno Unified, are you going to get any amount of health care? And all these multiple programs, Susan Wittrup kind of shed the light first, the giant flashlight, and several retirees came on board and have talked to everybody under the sun. Well, at least in the city of Fresno. What can you tell us? What is the status today of can retirees get health care?
Yeah, so there's a lot to unpack there, and I hope that you could hear me. Thumbs up if you could.
Yes, we can. Yes.
Okay, awesome. So there's a lot to unpack there in regards to it. The most basic answer is this. Folks have medical coverage. The reason why I say that is because there's some folks that maybe came to our office or called and said, do I even have health insurance? Yes, you do. The issue at hand is that they are no longer in network for community. The fastest way for that to happen in regards to getting in network and being able to get care is for community to agree to a contract extension, 30 days, short term, so that way those two parties could get together and start to negotiate a long-term thing. That's the fastest, most efficient way that this could happen. If that is not the case, the pivot to that is for folks to be able to see somebody that is in network, right? Again, you still have medical coverage. There's options in regards to that. I'm not saying that those are the best. I'm saying that that is the situation given the situation now, which is a contract dispute between Aetna and community, right? Again, the easiest, and I believe that you've shown this. There's a highlighted document. I think when Trustee Wittrup was on, you showed it as well. There is a provision that allows for not just community, but any provider within our plan that is out of network. All they have to do is simply bill Aetna, and Aetna will pay what's called the Medicare allowable rate. They'll do that for any provider that is out of network. Community is choosing. It is a choice. They are choosing not to do so. So when you ask the most immediate thing, that is the most immediate thing that could happen tomorrow in order to get widespread access to folks. Instead, what has happened is that they gave a very unclear response saying that they would allow people to see physician office visits and for prescription refills. The problem is that when you go to the doctor, I go to the doctor, anybody goes to the doctor, there's typically a data piece that goes along with that. Is there is there a lab? Is there an MRI? Is there something else that needs to inform the doctor's visit? They've been unclear in regards to those components. That's why we're saying the most clear mass communication, efficient way of doing so is a 30-day extension while they negotiate the remainder of this contract.
Thank you, Manuel. Bill?
Yes, Manuel. So I have a question. Edward Smith at GB Wire yesterday posted a story about Medicare Advantage, and millions of Americans are facing these same kind of challenges because the costs have gone up so much with the Advantage plans. And I'm wondering from FTA's perspective, how far out are you looking, and are you brainstorming ways to deliver on this promise to retirees, given how tough conditions are?
Yeah, great question. If I could maybe take us back, because for any of these topics, it's very context matters in regards to things. So, Bill, I'll definitely answer your question. Let me just come back to it in just a second. So, there's a premise out there, and I want to correct it because a couple of guests last week were the ones that are there's a group online on Facebook. They have a closed group, and unfortunately, what happens is that they have some half truths and misinformation that are going on. And what's taking place is that anybody that either sheds some truth or is a dissenting voice in there, they get limited access or even booted from that group. So it's an important piece, Bill, to know that some people have said this only happened because there was a switch to Aetna's Medicare Advantage plan. That's absolutely false. The issue at hand is a network dispute. And I believe I showed some headlines, and I gave some headlines to your producer. And in fact, I went back and looked at even your own reporting, talks about in 2023, this network dispute happens with community and other groups. If you do a Google search in regards to network disputes just in the last 6 months, you see a number of them across the country. Okay, now getting back to your point, Bill. So with that, we know in that same article, a majority of people in this entire country are on a Medicare Advantage plan, right? And so we know that a lot of folks are going that way. And in that, in 2023, the plan was offered in regards to this. We were already taking a look, as we do with all of our due diligence, to make sure that any issues are being addressed. In fact, one of the issues that we saw that folks were commenting publicly about this were if there was any type of potential denials, right? And our experience mirrors the person that you guys, Edward, quoted in that particular article, this Miss Rivera Gonzalez, who said that most of the denials came from administrative errors such as incorrect coding. And that had been our experience as well, that once those were addressed because of incorrect coding, not simply because they said, we're not going to do this, those things were addressed and people were able to get their care. So it's important. I thank you guys for doing that particular article. Now, we believe that we've addressed that. We gave them the option at JIMBY. We approved it last Thursday for those that would like to stay on the Medicare Advantage plan, which we believe most folks will do. They have the option to do so. For those folks that want to go back to the PPO plan, that they have the option to do that. When you see those two plans side by side, we do believe that a lot of people will probably stay with the Medicare Advantage plan because that has zero copays. I sent your producers the entire document. They could see it. Zero copays, zero deductibles, $400 max out of pocket in regards to pharmacy. So that for somebody on a fixed income creates a lot of stability. The PPO plan has some different challenges. It's a personal choice in regards to one over the other. In network for the PPO is somewhere about, out of network for PPO is somewhere around 40 to 50%. And yet out of network for the Medicare Advantage is going to get paid at the Medicare allowable rate. So we definitely think that folks will stay with that option, though people will be able to choose which plan they would like to go to.
So basically,
Matt,
if you
go
go
ahead,
PPO, you get more flexibility, but you're going to pay for that flexibility.
Well, I wouldn't necessarily say it like that because it's not the way that there's been a description as if the PPO just allows you to go to whomever you want carte blanche, and that's not necessarily the case. You still, in order to get the full benefit of the PPO, there is still a network. In this case, let's say if we were to extend it exactly like Aetna, you would still need to go with an in-network person in order to get the full advantage of the plan. If you had Medicare and you still had the PPO, and let's say in this particular one, just for example, it was Aetna, and you went out of network, then you're still paying an out of network price. So you're not going to get the full benefit, right? So there's give and takes in regards to this all. But in regards to the premise, the ultimate premise, the reason why I'm on here today is to talk about a lot of the disinformation that is going on and half-truths, because it's created it's taken a bad situation in regards to this network dispute, and it's made it worse because people believing that either they don't have insurance, that they lost their lifetime benefits, and those things are just not accurate.
I have a couple of questions for
Yeah.
you, Matt. Bill, are you done with that series of questions?
Yes, Doris, go
Okay.
ahead.
How long does it take to get out to move out of the Medicare Advantage plan? Is it? Can you hear?
Go ahead. Sorry, I missed that first part, but
yeah, how long does it take to to move out of the Medicare Advantage plan?
Yeah, so that takes a while. So here's the thing is that when we had the conversation with, again, a couple of leaders in this particular Facebook group, it is important that everybody understands in regards to it's not simply flipping a switch. If we could do so as an organization, I talk just as a system in Fresno Unified, we would do so. Anybody does just a little bit of research in regards to CMS and the number of regulatory items that take place, it takes a while to get there. We've told people in regards to the next open enrollment period, and that which would then be the fall winter of this year, leading into January 1 of next year. It is important. There is a new, very dangerous claim that is going on, and Jim B just released we can provide you the update. There is a claim that some folks are making that they could just simply disenroll. This is a half-truth, right? They're using it to say that, they want to keep you in the Medicare Advantage. We voted for choice. People could have the choice in regards to it. The half-truth is this. So please, anybody that might be a retiree in this situation in Fresno Unified, it is true for individual Medicare Advantage plans, there is a disenrollment period that ends on March 31st. That is true. However, that is not the plan these folks are under. They are under a group plan. And with group plans, there are different rules in regards to that. And so what happens is that the CMS allows for disenrollment at those particular times. So nobody's going to be blocked from that. You do not need to disenroll before March 31st. In fact, if you do, you may be disenrolling and you may be left with unintended consequences, right? Including disruption to your coverage and additional bills. So I want to make sure that that folks understand that. We'll have a more detailed response that you'll be able to read for yourself in regards to that. But it is a very dangerous claim that folks are putting this half-truth in regards to not knowing the difference between an individual plan and a group plan. And we want to make sure that people are advised and know the ramifications of any decisions that they might make moving forward.
Thank you, Manuel, for that. Are the networks rejecting the Medicare, allowable rates?
Well, not the networks. Remember, Aetna says that they're willing to pay the Medicare allowable rate.
So they are, okay. Okay.
Yeah, what's happening, at least locally, I can't speak for other places, what's happening locally is that community is choosing not to bill because they could simply, again, if one of our folks under this plan, if they went to the doctor, if they accept Medicare, which they do, and are willing to bill Aetna, then there would be no disruptions to the patient experience. They would simply bill Aetna. Aetna would reimburse at the Medicare allowable rate. They're choosing not to do so at the moment. When you ask widespread, what's the easiest, most efficient way of getting people access to their health care, that is the most immediate piece. And then after that, Aetna, community get back to the table so that way we can have a more long-term solution to this.
Wait a minute, I'm not following you. So they are taking they are allowing the rates. They are accepting the rates, the networks.
I want to make sure I'm answering the right question. Who are you speaking
to? Are they? So you're saying that they are accepting the Medicare dollars? Is that correct?
What I'm saying,
community health systems.
What I'm saying is that there is a network dispute. Because of that dispute, now this particular plan, this particular network is out of network. But there's a provision that allows, you showed it last week, I believe, the week before that.
No, we have it up, yeah.
If community simply bills Aetna, Aetna will reimburse at the Medicare allowable rate. That is not happening.
That is not happening, or that is happening?
Because, no, it is not happening, because if it was, people that were under this plan would be able to go see their doctors.
So how do we make that happen? Why is that not happening? Is it a community thing?
Right at the moment, it is a community thing because, in my opinion, it seems like they have the leverage with 65% market share in the valley, or excuse me, in the Fresno Clovis area. They have an ability to do this, and it feels like leverage, quite frankly. And so that's the unfortunate part. What we are asking for community to agree to a short-term 30-day, because that's the easiest way for folks to see people immediately, right? 30-day extension of this contract.
Edward's article talked about nationwide providers are dropping Medicare Advantage.
Yeah, again, I can't speak to that in regards to it. Again, there's two things that I know, right? I can't speak to nationwide items in regards to the two things that I know. Network disputes are an unfortunate part of our healthcare system, right?
Yeah.
And then if there are items like that across the board, obviously there's some issues that need to be discussed. However, what's happening here is a network dispute, right?
Got it.
Yeah. And then do you mind if I take a couple of items that I think are important to clear
Please
up?
do, because please,
there's been a lot. There's just been a lot of noise, and I get it. I want to make sure that I start with this, is that the impact is serious. In no way am minimizing the impact that people are feeling, but I also, on the same token, want to make sure that there is facts and opinions about what is happening, and want to make sure that people know the factual information that's going on. Okay, so there's a claim, again, I kind of addressed that this wouldn't have happened if we were not switched to a Medicare Advantage plan. That is, again, false. There is no way to prevent this. There is no way to prevent it in the future. It actually almost happened to our actives last year. Luckily, those two organizations were able to come to an agreement prior to the deadline, so that didn't happen, okay? But it's part of it. The other part is lifetime benefits. We've heard a lot. There's a disinformation that people lost their lifetime benefits. That is not true, okay? There's one sentence in our CBA that enumerates what lifetime benefits are. It says the district shall provide paid medical health plan benefits for retirees. That's it. That's the sentence. And then it just goes on to say what you have to do to qualify for that. Work X number of years and be a certain age. Nobody lost lifetime benefits. The district is still paying for those that qualify for their health benefits. The issue at hand is that the network and the provider are having a contract dispute. Okay, so I want to make that very clear. That is really important that people know. Okay. And then I already talked about the disenrollment. Please, if you're hearing that online, please make sure that you do your own work on that. And Jimby is going to release a more detailed statement. I would imagine the district will share that as well, because that is very dangerous and could be very costly to you. Okay, so I want to make sure that when you're getting the right information to our folks, right? So,
got it. Okay, complex issue. Like folks tell me, Middle East is a really complicated issue. Actually, it's not. It's very simple. People don't like to live under occupation, and in this case, people don't like to live with, especially if they've paid into a system or have been promised health care for the rest of their life. It's really difficult to take those away, and we're at the mercy of these two big powers, Aetna and community health system. So lots to unpack. Manuel, in the last couple of minutes, you have anything else you want to add?
Yeah, I think a couple of things. Number one is that we have done everything in our part, the school system part, to try to address this, right? Created last Thursday an option for folks to have that. That takes some heavy lifting in order to enact, right? There's a lot of regulations in regards to healthcare. By the way,
I'm sorry, that's the Jimby board.
That is correct. The Jimby board. Yes,
okay.
the Jimby board in regards. I think that's on the screen. I'm trying to see that.
Yes, it is.
Okay, yeah. So again, that's a representation of all labor and management who manage the health fund, and we are fiduciary. We have fiduciary responsibility to the health, both to the actives and to the retirees, to maintain a strong health fund in regards to that. So we had the options. The most important thing, the most immediate thing that could take place is to ensure that community approve a 30-day extension, so that way we're able to get our folks in as soon as possible. We want to be able to provide clarity. That's the clarity that we need, and then they could get back to the table and start to negotiate. Now, there's one other thing. I think, Bill, I see your hand up. There's one other item, Darius and Bill, that I thought was important to talk about in regards to clearing up this information. There's information out there. So people were never, FURA, the retirees, they were never brought on and talked to about this particular item prior to voting. That is absolutely not true. I want to say that again. That is not true. Prior to voting, FURA actually had a consultant. Okay, I have her name. I'm not going to say it publicly. If you want to know, I can tell you.
Who's FURA, by the way?
Oh, I'm sorry. FURA, I'm sorry. I'm talking inside baseball. FURA is the Fresno Unified Retirees Association, the organization that represents retired employees for the district. Now, FURA had conversations with JIMBY staff, JIMBY, the health fund, right? The board had conversations via that consultant, whether it be about the different aspects of medical, right? Pharmacy, those types of things. In addition to that, they also had a member meeting. And in addition to that, the district staff verified that they met with this particular consultant 3 separate times. These are all prior to voting. So any information, and we could document the actual dates. So any information that says they were not involved in the conversation, they were involved in the conversation, right? Now,
how many people are on that? How many people are on the FURA board? Or I mean,
that's a great question. I don't know the specific number on the board, but that's exactly what my next point was, is that as an organization for retiree folks, if they didn't do their due diligence in regards to getting out information, we can't speak to that component. We do know
great
that
point. That's a great point.
We confirmed that they did have the meetings prior to, again, both with staff, JIMBY staff, and with district staff, right? So we know that those items took place prior to a vote. So again, just want to make sure that people know that, because there's been information, well, they were not involved. Well, they were contacted and communicated with.
That's a great point. So the retirees knew about, at least their board or their representatives knew about what's going on. So this should not have been a surprise on January 2nd to so many folks that go, oops, I can't go get an appointment with my doctor, or my procedure has been canceled.
On that part, I want to say what I'm talking about is prior to the decision to go to a Medicare Advantage plan, right? In regards to communication prior to this, we know that JIMBY did send out a message in regards to that, and I believe Aetna did. I can't speak for community. I can't verify that, whether they did as well. We know Aetna, and we know JIMBY had communication about the possibility of this prior to that. It was sometime in December. I don't have the specific date with me.
Let me just quickly, before Bill comes on, healthcare costs go up, health insurance costs goes up. What is it, 4 to 8% every year? Prescription costs go up. I'm sure community health systems costs are going up. I don't know if Aetna is getting paid more, and they're deciding not to reimburse appropriately the added higher cost for community health systems. I'm not involved in those negotiations, but I know our insurance cost every year goes up. It's 4, 5, 6, 7%. We got to pay more every year. The insurance companies, they charge more because they want to make more, but also because their costs are going up. So I'm just really baffled. I'm hoping somebody between community health systems and Aetna is going, here's the issue. Here's what's happening to our costs. You're not paying, or you're paying, you're not paying enough. Adjust it, and on we go, so that the folks at Fresno Unified don't end up getting squeezed.
Well, it goes beyond that even, though. So Darius, that's a great step here, but let's go deeper, just a couple of steps deeper in regards to that, because let's say network, provider, and community says we want to get reimbursed at a higher rate. Aetna, they say, okay, we don't like it, but they agree, right? Hypothetically, right? You're a business person. What do businesses typically do? Do they eat that cost, or do they pass it on to their consumer? In this
Yeah.
case, Fresno Unified is the consumer. So ultimately, Fresno Unified and ultimately the taxpayer is the one that is eventually going to have to pay for those additional costs that community is wanting to charge, right? So that's just a couple of steps deeper in regards to that. And that's both on the PPO side and on the Medicare Advantage side.
Have you contacted, last question, anybody in the Trump administration to say, hey, our retirees all vote, by the way? I'm pretty sure there's super high propensity voters. They're going to get squeezed here because there's not enough money between the insurance money and what community needs to get reimbursed to take care of these retirees. Can we get some dollar? Can we get a grant? Can we get a? I mean, we're putting out billions of dollars every day and all other stuff, including defense stuff. Okay, have you applied for a grant to? Have you
Listen,
contacted President Trump directly?
Not yet. I do not have him on my phone. I could definitely guarantee that. I do not. We have been in contact, obviously.
How about
community leadership? We met with community leadership. We through our Jimby staff. They're in communication through Aetna. I will say this though. It's community. It's a hard thing. I think you described it, these two major entities, they're fighting each other. And what happens is that our retirees and actives and community members kind of get lost in that shuffle. And the frustrating thing is that, community has just this year, $2.74 billion in revenue. And with this, it's hard to see this happen when you have an organization that's that large. When we can't even get an extension for 30 days in order to get folks seen as soon as possible.
Got it. Mr. Kennedy, health and he's in health and head of the Health and Human Services, right, in the Trump administration. Have you contacted him?
I have not. Again, not somebody I have in my phone, but we have been again reaching out. We'll be reaching out to some local politicians to see if they might be able to lend, their ear and support in regards to our retirees.
Got it. Bill?
Thank you, Darius. So, Manuel, on another subject, GV Wire ran a story reported by EdSource about the $30 million investment in supporting students. The idea that these supports help the whole student or make the student become whole. You were quoted in the story as saying this investment gives disadvantaged students a fighting chance at learning what they need to learn. So far, it's kind of anecdotal information. The district says it is tracking the efficiency of these programs. 25 of the 30 million's been spent, and you have contract negotiations coming up. Is this something that you want to see happen again?
Yeah, I think that it lends itself for an opportunity to continue this structure moving forward. What that looks like, obviously, this is the first time doing this in our district that I know of, and so being able to do that, those were dollars that were allocated via various grant money and whatnot, so they were made to go to obviously these types of services for our students, right? So yeah, I mean, as we move forward, we want to make sure that we're listening to our community and our teachers about ways in which we could improve the whole child, so that way when they come to our campus and into our classrooms, they are ready to learn. And so you see that in that particular article, there are a variety of items, including a mental health app that's not just available for the student, but for all of the family. I think we could do more as an organization, again, Fresno Unified Total System, to let Fresno know about that. The reach of that 74,000 students and their household family, that's probably about half of Fresno, that they get mental health trained, professional mental health folks that are ready on the line for free, and a number of other items in various areas that will help our students. So yes, Bill, we look forward to anything that we could do in order to create a system that these types of investments will move forward.
And then in regard to the district, many people have said for a long time that Fresno Unified needs to find a way to engage with parents, to let them know the help that's available, to let them know, all the programs that are offered, whether it's magnet schools or, special programs, all these things. Manuel, do you have any sense that that engagement, that improved engagement is beginning to happen?
I don't have a sense because I don't get to see it from their side of the table, if you will, right? I do echo a lot of those concerns because they're the same concerns that our parents feel that we talk to. One of the biggest things is rebuilding trust with the community, right? Whether the systems in place that we have at the board meetings and whatnot, it should all be about regaining that trust. Bill, you've been around for a long time. I think you know. What happens is that if you go to the community and you ask for their input and then you start to not listen to them, eventually you're going to have disengagement. That's less about the communication and more just about making sure that you are actually doing the thing that they are telling you they need. We need to be doing more of that in addition to the good communication that should be taking place, right? And we look forward to that. We want to be a partner in that. Our teachers are the first communication line for many of our students and families. We need to do better to regain that confidence as a system. And I think, I'll be honest, I think that a lot of our teachers individually have the trust of their parents 100%, but as a system, how do we do that so that way folks feel like my school district is listening to me and wants to implement the things that I'm talking about?
Well, thank you. Thank you for answering the questions and thank you for being on tonight.
Thank you.
Thank you, Manuel. One question online from Christina Holmes McIntyre. She's saying, which is why this lifetime benefit never should have been accepted or provided as a benefit. Who's going to be squeezed or students? Comments on that? I mean, a lot of folks, in the private sector, nobody in the private sector gets permanent healthcare benefits, and that's her point.
No, absolutely not. I refute that in regards to that because again, through Jimby, we've been able to manage the healthcare system or the healthcare fund in a way that it gives everybody their benefits in regards to active employees and retirees. So I reject that in regards to that. And there's always ways in which we could address issues if they were to ever arise. But no, to say that in of itself it's a bad thing, absolutely not.
Got it. Looks like that's the end. Unless you have anything else, there's no other comments or questions online. By the way, I see that on GB Wire, Paramount Plus down for thousands. Down detector shows. This just happened 30 minutes ago. So if you can't get Paramount Plus, that may be an issue according to
Darius, can I get two things in really quickly?
Of course.
Just, super quick. Any of the things that I said here tonight, obviously trying within a quick half an hour, trying to make sure that I get all the information out. This is all public information. We created a frequently asked questions document. You can go to our Facebook page, Fresno Teachers Association Facebook page. It is there in text form. It's there for you to download, to print, to do whatever you would like. In regards to sending a letter to community, FresnoTeachers.org, you click a button, you'll be able to send to community to say, we support extending for 30 days so that way we could get our retirees access now. So thank you.
That's a great point. That's a great ask. By the way, I just got a point from Paul that Paramount Plus was that was a couple of hours ago when they were down, probably briefly. And as we get these data centers trying to go up, burn a lot of electricity, it'll be interesting to see what happens to data and streaming in our country and our world going forward. Okay, Bill, any other final comments?
No, not at all. Just again, thank you for being on, Manuel, and answering the questions and adding some clarity to a muddled situation.
I hope so. I hope so. Please, folks, we have the information there. Please make sure you're reading and consider the source about what's going on. So thank you so much.
And Manuel, thank you for, again, coming on. I want to echo Bill's remarks. And thank you for being available to GB Wire. There's a few folks at Fresno Unified that never show up on this show. We still can't figure that out. and are not as available to address the questions of the public, really, that GV Wire is trying to get addressed. So thank you for being available and addressing this important question for our retirees. Appreciate it. Thank you, Manuel.
I appreciate it. Yeah, thank
Okay.
you so much.
On behalf of all of us at GV Wire Unfiltered, thanks everybody for watching. See all of you next Tuesday. Have a great week. Good night.